In functional psychiatry, instead of saying you have depression, that's your diagnosis, here's your medication, we're saying, okay, let's look at depression as a symptom. What's going on with your entire body and how is your body affecting your mind and your mind affecting your body? When there's a lot of stuff off with thyroid, estrogen, progesterone, testosterone, all those hormones, and even gut health, I start looking at how are stress levels? What are you doing in your life to decrease them? Is that an issue?
Welcome to The Trusted Pharmacist, where you'll learn the truth about how the body works. Welcome back to the Trusted Pharmacist podcast. I'm your host, Steve Hoffart. And today is one topic that people come to me all the time looking for solutions. And I hate to say traditional healthcare just doesn't provide that. And that's that mental health space. And today I've got a guest that I've heard speak that really has a great analogy and setting to help change mental health and make a difference with a more root cause approach. It's Everest Goldstein. She's a board certified psychiatric nurse practitioner and certified functional medicine provider who's changing the way we think about mental health. She's the founder of the Everest Functional Psychiatry and Wellness in Dallas, where she blends integrative testing, root cause analysis, and personalized care to help patients truly heal and not just manage their systems. So I want to welcome you. Thank you so much for joining me, Everest.
Yeah, well, I'm so excited to be here. Thanks so much for having me on, Steve, and just so excited to chat all things mental health and functional medicine.
Very cool. We also got the Texas connection working, so I'm kind of looking forward to that as far as that goes. So I always like to ask practitioners, there's always something that kind of got you in this space. What got you going down the middle or the actual functional side of psychiatric care?
Yeah, so it was honestly my own personal health journey. I've always been interested in mental health care, for as long as I can remember, and just working with that population. I studied psychology at Princeton. I really focused on like the special education side when I was teaching after college. And then when I went back to school, I knew that's what I wanted to specialize in. But through that whole journey, so before I went back to nursing school, I actually got Lyme disease. And it wasn't caught. And so it turned into kind of chronic Lyme disease. I had a lot of chronic health issues, and nobody could figure it out. I was going doctor to doctor, all conventional medicine, and they were great. But I feel like in conventional medicine, there is a piece that's missing for more chronic diseases and also just looking at the whole picture and the whole body. So I had, a GI doctor. I had a rheumatologist. I had an infectious disease doctor, and nobody was really talking, and nobody was like, what's happening with your entire body? So I ended up with a functional provider, kind of like had no idea what functional medicine was. And I just kind of ended up seeing her, and I was like, why is she asking me all these questions? Like, why does it matter what happened to me at birth or like all these things? She basically figured out what was going on, treated me, gave me back essentially like my quality of life. And from there, I was like, wow, there's really something to this. Like even just looking at the foundations, no one had asked me about sleep. Nobody had asked me about diet before. Nobody had asked me about exercise. So when I kind of went through that whole approach myself, I was like, this is like really what's so important to incorporate in whatever type of medicine we're practicing. So basically, I just combined that with my psychiatric, passion and kind of started doing functional psychiatry.
Very cool. And I'll tell you right now, when I read your bio and saw that you were a teacher, there's no wonder you needed some help there on the middle side, because my wife's a teacher. And trust me, I feel like that's a nonstop job as far as that goes. So I applaud all the teachers and educators out there, because that's definitely a middle beat down many, many days. So one of the changes as a pharmacist I get, people come in all the time with all these type of illnesses, from anxiety, depression, to mood stuff. And I hate to say it, the traditional realm, allopathic medicine, like I was initially taught, and like you were initially taught and your training is medicines and that. I kind of tell me a little bit, how does functional psychiatry look different than traditional psychiatry?
Yeah, so good question. So functional psychiatry, it's basically taking the principles of functional medicine. So just that root cause approach, using both conventional and alternative methods to get to the root cause and treat the root cause of the symptoms, as opposed to just like putting a Band-Aid on something. And when we look at conventional psychiatry alone, it's very medication heavy. So in conventional psychiatric schooling training, we're taught like, okay, here's this book called the DSM-5, right? Which is our psychiatric diagnostic manual that has had already 5 versions of it. So it's a little bit subjective to begin with, in my opinion. And basically it's a way to kind of categorize groups of symptoms and give them a diagnosis. So we can figure out how we're going to diagnose depression or anxiety or ADHD based on if somebody has a certain number of these qualifying symptoms. So we're taught, okay, you take that diagnosis and then we do first line of treatment. And most of the time, that first line of treatment is a medication. So for example, with depression, first line of treatment for depression is an SSRI. Well, if the SSRI fails, second line of treatment is an SSRI. If the second line of treatment fails, we go to a different medication and so on until you're labeled treatment resistant and kind of like sent along your way of, sorry, nothing's really working for you. You just have this chronic depression. Well, in functional psychiatry, instead of saying you have depression, that's your diagnosis, here's your medication, we're saying, okay, let's look at depression as a symptom, not necessarily a diagnosis. And why are you having symptoms of depression? Is that coming from something where maybe an SSRI would be helpful? Or is there something else going on? Are your hormones out of balance? Is your gut health off? Are you deficient in certain nutrients? Is your cortisol off, that stress hormone? And if your cortisol is too low, an SSRI is actually going to make you worse. So just like looking at the bigger picture of what's going on with your entire body and how is your body affecting your mind and your mind affecting your body.
Yeah. And you're a lot like me in that whole chemical imbalance theory model where, okay, you're depressive, you're low in serotonin, let's give a drug to fix it. And what's even more crazy about that, even with that model, neurotransmitters are never even checked. It's just, we throw that in and as well as me, there's so many things that can go wrong with serotonin production. And I always laugh at that. And that's a pharmacist thing. And you laugh. As a pharmacist, I'm trained, if they bring an SSRI to the pharmacy counter, we'll say, hey, if this doesn't work, give it 6 to 8 weeks and then be sure to let your doctor know because they'll just try another one and maybe the next one will work. And so you're exactly right. We missed the thing and you're right. It is definitely a Band-Aid approach, which is a little frustrating. One of the big groups that come to me the most with anxiety and depression is peri-menopausal and menopausal women because as well as me, we're talking root cause. Well, one of the big things that happens there are hormone changes. And I'm sure you would agree, hormones play a little bit in terms of mental health, right? What do you see on that? Like, what's the trends right now in terms of mental health with perimenopausal and menopausal women?
Yeah, it's something that I think is definitely gaining more awareness, which I am super excited about because I think for so long women have just kind of been told like, you're perimenopausal or you're in menopause and, you're just going to be hormonal and kind of feel crappy. And that's just your life. Right. Whereas now people are saying, okay, there's things we can do about this. And some of these symptoms you're having, it doesn't mean you're crazy. Like you're having hormonal changes that are causing insomnia or weight gain or mood or anxiety issues or more irritability. And there's nothing wrong with you. It doesn't mean you're what, people will come and say, well, I think I'm crazy. It's like, you're not crazy. There's just imbalances in your body that we need to work on balancing and get you back to feeling good. So, I think there's a whole thing in the hormone replacement therapy world once you enter menopause, which working with someone, if you are going through that, who is familiar with that and can weigh risks, benefits, all of that can be really, really helpful. But even with perimenopause, I have a lot of people whose primary care providers will send them to me for psychiatric care because they're like, oh, you have more anxiety or you have more insomnia. You need to just start a medication. It's just because of your mood or whatnot. And then they come and I'm like, well, no, let's look at, your body has been changing. So we need to optimize diet. Are you balancing your blood sugar? Are you getting enough protein? That's going to affect not only your mood, energy, anxiety, but also sleep. And then also, can we naturally balance your hormones? Do we need more support there? Kind of what's going on and what's driving the imbalances in the first place.
Yeah. And that perimenopausal years are important. And this because that progesterone begins to change, and progesterone, especially for the anxiety piece and the sleep, like those are the two big things. And then I get so frustrated when you have a lady that goes through a hysterectomy and the doctor's been trained, oh, you don't have it. You don't need progesterone no more. We just,
Yeah.
and like that drives me so crazy because that is so critical for the brain, progesterone. I mean, like you said, and that's something that I think happens a lot in perimenopause. Do you see that too sometimes?
I see that all the time. And, what I love, like, you even working in compounding pharmacy, what I love is you can adjust dosing of progesterone because either providers are like, oh, you don't need any more of that, right? And then you struggle with sleep, anxiety, mood, all of the things you just mentioned. Or it's like, okay, we can only in a regular CVS or Walgreens, you can only call in 100 milligrams or up of progesterone, but sometimes that's even too much. So people aren't feeling good on that either. So it's good to be able to have ability to like alter dosing, alter formulations to really fit that specific patient, especially during perimenopause when all of that is changing.
Wow. That is a great call out because you're right. To try to say that every woman fits in 2 buckets of progesterone because that's what's commercially available is absolutely crazy. And you know that because it takes everything. And so many people are so sensitive to different things. So in taking the root cause approach, this is the one thing I've never understood about psychiatry. So maybe you can help me. So patient comes in and has symptoms, like you said, not the disease. It's more symptoms like depression, anxiety, all these type things. And you go through all these questions. But like when somebody has blood pressure, we put a blood pressure cuff on them. And when somebody has a temperature, we put a thermometer in. Or if they got low oxygen, we put a pulse ox. But psychiatry is that one, and I think it's happening a little more now, especially in your realm. But there's like no way to like a diagnostic. You know what I'm trying to say? You can see what the therapies are doing. Tell me a little bit that in the functional medicine world in terms of psychiatry. Is there things you can do to kind of see how the brain is working?
So there are. I love that you pointed that out because that's kind of what I was like even trying to get to in the beginning when I was saying, we have this like very subjective diagnostic manual, right? That's our like psychiatry Bible, as you will. And that's the only way we really can diagnose things because we really don't know a lot about the brain. However, that's not super accurate in my mind. And it's, again, so subjective. However, there are ways to monitor what's happening in the brain especially in terms of like improvement and treatments and stuff like that. So one way is what's called an EEG, which is a brain scan. And it's really awesome. So some different treatments, like if you've heard of TMS, you can utilize that in that, or neurofeedback utilizes an EEG. So you can look at your brain waves and if they're moving maybe too fast or too slow or, what's happening in different parts of your brain. And again, it's not perfect, but it can be really helpful. And then you can implement treatments and then redo the EEG and kind of see if any changes have happened. So, and again, with all of these, there are some subjective sides to it, but that can be helpful as like a more objective, here's like actual data happening in your brain. And then also, in my practice, I really go a lot by how somebody feels, to be completely honest, and what's going on in the rest of their body. So for example, gut health, 95% of your serotonin receptors are in your gut, 50% of your dopamine. So when your gut's off or you're struggling with gut health, that's going to impact your mental health. So a lot of times I'll do maybe like a stool test or, looking at something specific in the gut and say somebody has a really inflammatory bacteria or parasite, or there's something we can actually like measure in the gut. We can treat that and then we can test to make sure that's gone. And a lot of times that will also clear specific symptoms. For example, like yeast overgrowth will cause a lot of anxiety. So if we clear the yeast, people are like, my anxiety feels better. And we can also retest and make sure that the yeast is actually gone. So there are some ways around testing, but in terms of actually looking at like, okay, is this depression or is this anxiety? Is it gone? It's pretty subjective in terms of just more like how somebody feels symptom wise.
Yeah, gut brain connection. Like you brought that up. Like I think if there's any one thing that I wish every at least like general practitioner could put together, like that's the one thing is put together gut brain connection because they don't get it. So you mentioned serotonin and dopamine, like so much of that's made in the gut. But tell me a little bit, like it's made in the gut, but like, how does it get to the brain? What's that cross channel talking that happens with the brain and the gut? There's a certain type of thing that works in there, I think called the vagus nerve and things like that. Tell me a little bit, explain to the person that's listening how the gut brain can talk when they're kind of so far apart from each other.
Oh, for sure. And that actually reminded me too, another thing that we can measure that's really helpful in mental health is you can do a neurotransmitter test. Again, all of these, there are, positives, negatives, whatnot, but actually looking at like neurotransmitter productions, that can be helpful. And also a salivary cortisol test where you're looking at cortisol levels throughout the day, which cortisol is kind of our quote unquote anxiety hormone, right? Or it's our adrenal glands are producing it. So it can really affect like fatigue, energy, anxiety, all sorts of things. And you can measure what's happening with that cortisol throughout the day to see if it's too high or too low at different points. But one thing that controls that, which you also mentioned, which impacts gut health and so many other things, is what's called the vagus nerve. And the vagus nerve is, oh my gosh, I love the vagus nerve. It's so important. But it's basically, in a simple way, I kind of like to describe it as what shifts you from that sympathetic fight or flight state to your parasympathetic rest or digest state, right? So if we are like undergoing chronic stress, or we have even damage to our vagus nerve or whatever it may be, we have a really stressful job, we might be chronically producing a ton of cortisol and be in a very high cortisol state. We need our vagus nerve to function to be able to switch us from that chronic fight or flight state to a more calming rest or digest state where our body can start functioning better. Our, for example, with GI, like your motility will start working better. Your stomach starts working better. Your body produces hormones better, all of those things, because it tells our body we're in a safe space. And what's really cool about the vagus nerve is I think of it as almost like a muscle in a way. It's not necessarily, but I like to say we can train it. So there are a lot of things we can do to help kind of get our body out of that fight or flight state. This is really great, especially for those people who are feeling very physically anxious or like, oh, I feel it in my chest. My mind might not be racing, but I just feel like really tight and tense, or kind of wired and tired, that kind of thing. And so you can do things like meditation, hot cold therapy, breath work. There's even devices, like I use one called the Pulsetto that like basically you put it around your neck and it like stimulates the vagus nerve with some electrical vibrations, different things like that, humming, singing really loudly. All of those things actually activate your vagus nerve and will help your body switch into that fight or flight state.
Very cool. And you mentioned something else too. You mentioned cortisol and stress. And we talked about how important gut health is. And I always think about how our brain is so affected when we have a lot of cortisol, because that cortisol causes this leaky gut syndrome and triggers that brain inflammation through our microglial cells. Explain that a little bit, how that affects your mental health.
Oh, yeah. Cortisol affects your mental health in so many ways. And it's kind of, I like to say, the top of the pyramid. So cortisol, or your adrenal glands are what produce cortisol in your body. If there are imbalances in that, so if you are chronically stressed, you're not taking care of yourself, you're just in this fight or flight state, your body's producing too much cortisol, that's going to impact everything else in your body, essentially. It basically bleeds down and starts affecting your thyroid, which then affects your sex hormones. So a lot of times when there's a lot of stuff off with thyroid, estrogen, progesterone, testosterone, all those hormones, and even gut health, I start looking at, okay, what is your, how are stress levels? What are you doing in your life to decrease them? Is that an issue? Because if we don't correct that, then nothing else is going to be corrected. Cortisol will always affect gut health. So if we do all this work on fixing your gut, but we don't actually incorporate like a rebalance of how you're dealing with stress, your lifestyle, all of that, your gut's probably going to go straight back to where it was. And cortisol is what causes a lot of anxiety too. So the interesting thing about cortisol to note too is our adrenal glands produce that cortisol, right? So in an ideal world, if we think about like the Paleolithic era, right? We're all cavemen, and a saber-toothed tiger, a tiger comes, I don't even think there were saber-toothed tigers then, but a tiger comes by our camp. My body's going to start producing cortisol. I go into this fight or flight state. My body stops producing like hormones properly. It stops digesting food because that's not what's important. What's important is for me to survive this tiger. Well, the tiger goes away. My body should go back into a relaxed state, stop producing so much cortisol. That's normal, but very few of us in this world and day and age live that life. We can't determine the difference between a tiger and a really stressful work event or a stressful email we get. So a lot of us are in a chronic state where our body just is continuously producing cortisol. However, our adrenal glands can't do that for too long. So after a certain amount of time, they basically say, hey, we've got no more gas in the tank. We can't keep hyper producing cortisol. So they just kind of shut everything down. And then you start producing too low of cortisol. And that's when people get really tired. They can't get out of bed. They have no motivation. So cortisol really affects so many different parts of mental health and also physical health. And to know what phase you're in that cycle, are you producing too much? Are you producing too little? Like kind of what's going on can be really helpful in terms of like how you would treat that and how you need to adjust your lifestyle.
Are you recommend like a 4-point salivary cortisol to kind of see where they're at on that adrenal function? Is that what your kind of go-to is?
Yeah, I love doing that. I think that can be super, super helpful because then we can see, some people produce too much cortisol in the morning, but too little in the evening or vice versa. And we can kind of see where the interventions need to be and what kind of interventions we want.
Cool. I want to jump into something really quick back to gut health, only because you use a term in your lecture that like I love to use, and that's psychobiotic. That there actually are certain bacteria that live in our gut that affect our brain. Talk a little bit about that.
Yeah. So psychobiotics, if anyone wants to go down the weeds, start researching that because it's a really interesting kind of newer discovery, I guess. Not super new, but it's more and more research is coming out about them. So we all know we have a bunch of different types of probiotics, gut bugs, in our stomach that create our microbiome. Well, they found that certain probiotics, which we're calling psychobiotics, are very beneficial for mental health and can actually impact what's happening in our brain. So you can take, just like you could take a probiotic, you can take, well, it's still a probiotic, but a strain of probiotics that really, there are different strains that specifically will like decrease inflammation in your brain that can improve mood, improve anxiety, cognition, all of those things. And so there's a few companies that are really making products that specifically have those specific strains in them. And so it's targeting what's happening in your gut, but that intervention is really affecting your overall mental health. So again, showing that gut-brain axis connection there. And I don't know if we mentioned it, but there's something called your blood-brain barrier. And that's how a lot of this works is things are able to cross, from your body or your gut or whatnot into your brain, if they're able to cross that blood-brain barrier and make impacts in that way.
That's cool. Yeah, no, I've gone down the rabbit hole way more than that. And like I look for things like Lactobacillus rhamnosus, Lactobacillus reuteri, actually for oxytocin, which is kind of cool. There's there's a Bifidobacter longum. I mean, it's really kind of cool. There's some really, I don't know. I get in the weeds on that stuff, but that's,
it's awesome.
That's me nerding out on that stuff.
Yeah. And what's so cool too, I mean, I always suggest working with like a provider or pharmacist or someone who can kind of help guide you there, because what's also interesting is sometimes you don't want to take like the psychobiotics with other probiotics because the strains will interact or they're not as effective. So there's a whole world of like how all of these gut bugs kind of work best in your body, which is really cool.
Very cool. So you mentioned some testing already as far as that goes. And you, like you said, because we don't really have a monitor or a meter we can put on the brain per se, What are a couple, just quickly, some of the other like blood tests that you like to run that you think are key in terms of determining where brain health is along with the symptoms when you're helping working with a patient?
Yeah. So a lot of the tests I mentioned earlier, like cortisol, gut health, neurotransmitters, those are all what I call specialty tests. You can't get a lot of them from like a lab core or anything like that. But I do like to run on most everybody a comprehensive blood panel that you can get, at any lab essentially. But things that I'm looking at, so, your basic CBC, CMP, all of that, just to kind of check that out. But I really like looking at what's happening with blood sugar. So let's get a hemoglobin A1C. I also look at a couple different nutrients that can be chronically low in mental health, like in depression or anxiety or ADHD. So I'm looking at, what's going on with B vitamins. Are you methylating them well? Look at a good homocysteine to kind of help me out there. Obviously vitamin D, zinc can be really helpful. A couple different nutrients in that world. Sometimes I'll do an omega check. But a lot of times with that, I can also just, ask someone how many, like if they're eating fatty fish or what their diet's like, and that can give me an idea. And then I also really like looking at inflammation. So I'll run like CRP on people. I'm making sure there's no autoimmune conditions. Also ferritin, iron. That's very important. You don't want too low of that, but a lot of people don't realize you also don't want what's called hemochromatosis of like way too high iron. And I see that cause a lot of mental health things too that's often missed. There's so many more. I'll run like hormones, and I'm trying to like think through my panel, but kind of depending on what's going on, I can adjust that. You can get a morning cortisol, which I'll do sometimes, but again, it's not the most accurate. I really do like the salivary cortisol for that.
No, yeah, you nailed so many important ones, like the inflammation factors, like that's important, certain nutrients, which are key. And then the other thing I think you brought up is methylation pathways. Like I didn't realize how important methylation is in terms of neurotransmitter production, metabolism, detox, and all that. And mental health wise, those can be huge for those patients that struggle with that. All right, I'm a pharmacist, so let's geek out on some drugs and medicine. I don't like traditional meds, but there are some things in the functional psychiatry world I think that gets used that I think is pretty interesting. Let's talk some just over-the-counter supplements. I would love to get your thought when it comes to magnesium, because I've got like about 10 million views on magnesium videos, because like for some reason, magnesium's hot. But magnesium's hot for mental health though too. What are the forms of magnesium you like the best for mental health type stuff?
Honestly, I am really a big magnesium glycinate girl. And so I would say the biggest ones, the main ones I use are magnesium glycinate, magnesium citrate, which is more for like constipation. I don't use it as much. It's more of like a natural laxative. And then there's also magnesium threonate, which is really great too. However, I find that one's more expensive. It does technically cross the blood-brain barrier. So people say it really helps with cognition, stuff like that. But I find that magnesium glycinate kind of does a better job. I don't know why. I think it just targets more anxiety, sleep, mood, all sorts of things. And it is cheaper. So magnesium glycinate's my go-to. I think it's something that like most everybody would benefit from. Most of us are deficient and can be really, really helpful.
No, that's a great call out, man. You're a magnesium rock star. I'm impressed, because one of the things I'll say is you're right. Magnesium glycinate's a lot cheaper. One thing people don't realize with magnesium threonate is that threonate molecule is very big. So there's not a lot of room for magnesium. So if you look at elemental magnesium, where if you take like a glycinate capsule, you can get about 120, 150 milligrams of elemental magnesium. With threonate, it takes like 2 capsules to get to 100. So you're right. It may get in the brain better, which I think it serves a role, but you have to take a lot more and it is way more expensive. So that's a good call out. What other supplements do you find yourself recommending over the counter? You mentioned one that I think gets forgot a lot, but I think it's great for mood stabilization. You mentioned over the counter low-dose lithium. Tell me about that.
So lithium orotate. So, we've most of us have heard of lithium as a medication, right? Which is what's called lithium carbonate. It's much higher doses. You have to do testing to make sure you're not getting too high of a dose. It can be extremely helpful. It's like one of the FDA approved drugs for suicide. It can really help in manic, depressive, all sorts of different things. But what people don't realize is lithium itself is it's an element. It's on the periodic table of elements. And it is a micronutrient in a way. It comes from the earth and it's actually in our water supply. And when you look at like maps kind of comparing lithium, the amount of lithium in water to like the amount of mental health conditions in a certain area, you'll notice that lower rates of lithium in the water, there's a lot higher mental health conditions going on there, more depression, anxiety, ADHD, kind of like everything across the board, irritability. So what's really awesome to realize is lithium is what I like to call a micronutrient, and you can supplement with it at lower doses using what's called lithium orotate. And a lot of people in the mental health world are just taking this kind of as like another vitamin. Now, you don't want to take it if you have, and definitely talk to your provider if you have like any kidney issues as well as thyroid issues. Like there are some reasons you wouldn't want to take it, but just like with any supplement. But it can be extremely helpful as like I find it really helpful getting people off of antidepressants or off of medications or alternatives for ADHD medications. Anybody who's irritable, just kind of boosting your mood, because a lot of people are actually deficient in lithium, especially if you're like Uber filtering your water and, that kind of thing, or don't drink a ton of water. Or you live in somewhere where there's not a lot of lithium in the water. The other interesting thing about it is, and this is a shout out to Dr. James Greenblatt, who's an amazing functional psychiatrist, but I learned this from him. So 7-Up, actually, when they first made it, was made with lithium, and lithium's periodic elemental number is like 6.9 something. So when you round up, it gets to 7. So they named 7-Up, the drink 7-Up, because it was relating to that number. And then it like helped boost your mood because it had that lithium in it. So I just found that as interesting. They no longer make it with lithium, but another little fun lithium fact.
Oh, that's really cool. All right. I like that one. I've heard a little bit of that story, but not to that detail. So that's awesome. Thank you so much for sharing that. But as we talked about, I'm not so much a biggest fan, and there's a place for traditional meds when it comes to mental health type stuff. But let's talk about a couple compounded meds that I think go after root cause issues, not try to band-aid, like you said, depression and anxiety. Talk about a couple different things. One of them that it's gotten really popular lately is methylene blue. And I'd like to hear your thoughts. It works on a couple of different mechanisms in terms of, I think, mental health. What are your thoughts on methylene blue? Do you use that much in your practice?
I do. I love methylene blue. So I really like methylene blue because it is technically, I think what it's used a lot in the functional world it's also used in conventional medicine and like surgery in a totally different way. But in the functional world, a lot of people use it because it's very antibacterial, has a lot of benefits for energy, for chronic disease, stuff like that. But what's really fascinating is it's technically actually an antidepressant. So it does have mood boosting benefits. It can impact that serotonin in the brain. And so I love it, especially for someone who's like kind of wanting to avoid conventional meds, really low energy, lower mood, also maybe has some autoimmune issues or chronic infections, things like that. I've seen it make a huge impact. And then you can actually pair it with red light therapy, which can also impact mental health in a positive way, as well as physical health. And that actually helps your body like absorb and utilize that methylene blue more. Just make sure if you do take it, note your pee will turn blue. So you're not crazy.
Fun story I was told. If you're taking it, the way that you leave a mark with your friends and family is when you go to their house and eat dinner. You go to the bathroom, you pee, you don't flush, and then you leave, and then you freak them all out. So that's kind of
I love that.
Fun story on that. So that's really cool because you're right, methylene blue. And I think the other part is too, especially in terms of our mental health, you're right. It does prevent the breakdown of certain neurotransmitters, which allow some of the neurotransmitters to work longer. But then the mitochondrial aspect of just mitochondrial dysfunction is such a big thing. And it helps supercharge mitochondria that are a little sluggish. And that plays a big role in mental health.
For sure.
Another big thing too, that I think I've got tens of thousands of patients on this because it is a true game changer, and that's low-dose naltrexone. And one of the first things I remember, one of the first real good studies on LDN was the use of LDN for treatment-resistant depression, actually, and they ran it up against an SSRI. Tell me a little bit about how you think LDN, low-dose naltrexone, works for mental health type stuff.
I think it's such a big game changer, especially for that treatment-resistant depression. So Ldian works in so many different ways. It is such a fascinating medication, and I feel like I keep learning like new mechanisms of action behind it that keep coming out with new studies and whatnot. So it's a very you take naltrexone at a higher dose, again, kind of like the whole lithium thing. Naltrexone is actually a medication that's often used for like alcohol cravings and stuff like that. But they found that like super low doses of that medication. So instead of using 50, 100 plus milligrams, you're looking at up to like 4.5 milligrams, sometimes even lower, sometimes a little bit higher than that, but around that dose can really help with so many different things that are ultimately the root causes of depression. So, one way that it really helps, it can really help with thyroid health, and thyroid plays a huge part in mood, anxiety, things like that. It's very anti-inflammatory. So depression, there's a lot of theories showing that depression can be actually a like disease of inflammation in the brain. So if we can reduce inflammation, especially if somebody's having, like if they have a very poor inflammatory diet or they're struggling with some sort of inflammation, if we can use LD and help reduce that inflammation in the body, it's going to ultimately also reduce the inflammation in the brain and help mood. And like there's so many different ways it's working. It also helps with, I find it very helpful for people with like maybe binge eating conditions, or again, it does help with any cravings. So more than just food, but also substances, it can be really helpful there. And it's so mild. I really find like the only side effect I ever hear people complain of is like maybe some more vivid dreams, which isn't always a bad thing for everyone. But I've really found it help with like almost every type of mental health condition, as well as energy and sleep.
Yeah, and you're right. That's one of the things we see a lot, especially with patients like with Hashimoto's with it, is that a lot of times they're tired, run down, fatigued, and that really helps. Because, believe it or not, one of the kind of crazy things is it does boost a little bit of dopamine every time you take it too. And that's another thing that LDN can do. So it's kind of cool. Oh my gosh, I could talk to you all day long. A couple more quick things I'm going to point out. Tell me a little bit. One of the things that working with ladies with perimenopause and menopause, I feel like one of the things is they really need some counselor. I mean, sometimes I'm like, before I even want to touch your hormones, you really need some therapy. I mean, really, honestly, to kind of work through things. A lot of people have past traumas and childhood incidents and just different things that have happened. But there's a unique drug that's being used now that I've seen that if you use it, and I'm not saying to say for perimenopausal, menopausal women, but I'm talking about just in general. So therapy to me is so critically important in terms of all these other little things we work on. But if you got somebody that's got treatment-resistant depression and you use a drug, ketamine, it allows you to do some new type of counseling and get to places you can't normally get to by just giving the drug by itself. Tell me a little bit about ketamine and use. Do you use much ketamine?
Yeah, you just made my day by the way that you like started that with the importance of therapy combined with it, because this is my thing with ketamine. I think it is an amazing resource for the right person, right? Again, like nothing's for everybody. But I actually used to work at a clinic where we did ketamine. Now I use it and I refer to different clinics depending on what form of it we're wanting to use. But it can be so extremely helpful, particularly with like PTSD, but also treatment-resistant depression, kind of almost everything. It's not like FDA approved for everything yet, but hopefully we'll get there. But the big thing with ketamine, so ketamine basically allows your your brain to create new neural connections. So if you are stuck, say you had a really bad trauma, your brain kind of is rewired in that sense to like really be, if you're having PTSD, like you're focusing on those symptoms, your brain's kind of wired in a way that's keeping you in that PTSD cycle. Well, ketamine allows those neural pathways to kind of like, this is probably not the most like scientifically correct, but it's an easy way to kind of think about it from a grand scheme of things. But it allows those neural pathways to almost like loosen up and break, and then allows you to retrain those or like reform new neural connections so you can move past that PTSD. However, the importance with ketamine, which I love that you brought up, is that you actually create those neural pathways, those new neural pathways, which really what you have to do that is go through therapy and process like whatever the trauma was, or process what's driving the depression or the anxiety. If you miss that processing step, yes, you will feel like happier and better, but it will wear off in a couple days. And then you've never actually done any of like the new training of your brain. So your brain's going to go back to its old patterns. I have some clients that, before they even saw me, they've been doing ketamine for 2 years, and it is expensive, let me tell you. And so they're like, oh yeah, I do it, but they won't go to therapy. And it's like, they feel better for a couple days, a week, maybe 2 weeks. And then they go straight back to their other symptoms. And I always tell them, like, within that window where your brain is more, those neural pathways are more fluid, you really want to work with a good therapist to like process what's going on, and really utilize that benefit of therapy so that your brain can stick in that happier place, if that makes sense.
No, perfectly good sense. And I'm glad I brought that up because I do see that working with patients with ketamine, like that is so critical. You put those two pieces together and it's like 1 + 1 = 3 because you get that extra, those new pathways and just, it's powerful for what it does. All right, really quick one. Patients coming all the time for themselves or for their kids, especially with school year starting right now. People like, hey, my child has ADHD. For you, just like a quick, like 3 or 4 top of mind things. These are the things that I would attack versus giving Ritalin and all these stimulants. What are the top 3 to 4 things you either attack or want to work on, or a supplement or 2 you would give that you think makes a big difference there?
Yep. Number 1 would be diet. So reducing sugar, cutting out dyes, food dyes, figuring out if somebody is reacting to gluten or dairy. Food, like dietary triggers, are the number one thing I see driving symptoms of ADHD, even things like autism, all of that. So that would be number 1. And a lot of kids, have very high sugar diets, all of that. Number 2 is incorporating, especially if it's like a kid with more hyperactivity, making sure exercise is part of their daily plan. For example, my cousin has very severe ADD. He was kind of raised with us, but he started running a mile before school and middle school every single day and was not on medication. Symptoms would stop. But if he doesn't do that, then he's like bouncing off the walls all day. So exercise can be very, very important in that. Number 3, I'll give one more. Let's see. Supplement wise, we can talk about that. Anything that kind of improves dopamine. So again, you always want to work with a provider to make sure there's no contraindications, but like, there's a couple different ones, but looking at anything like, tyrosine, some of the amino acids that can help produce dopamine, anything that's going to help with gut health, since 50% of your dopamine is in your gut, that kind of thing can be really, really helpful. So yeah. And
Very cool.
Also lithium orotate.
There you go. I love it. Thank you so much. That is so awesome. I could sit and talk to you like all day long because like I'm just going to tell you like this mental health just gets so bypassed by traditional medicine, and there's so many people looking for answers, searching everywhere, and sadly there's some good stuff out there and there's not a lot. Like you mentioned a pioneer in functional health and functional psychiatry that I follow. And like you said, matter of fact, that's the ADHD thing. His book, Finally Focused, like that's just such a powerful book. For parents, I recommend that a lot for them to read it. You brought many powerful things that patients can practically put into daily use, whether for themselves or for their family members. But if people want to learn more about you and some of the stuff that you do with functional psychiatry, where can they find more information about you, Everest?
Yeah. So you can go to my website, Everest Functional Psychiatry and Wellness. I also started another practice that we're kind of working on with another provider. So that's exciting. But also you can follow me on Instagram, Wellness with Everest, and reach out in any of these methods or, any of the ways. And I would love to connect with any of you all.
Awesome. Thank you so much for your time today. So many pearls, so many nuggets that I know our audience will really enjoy, and really appreciate you taking time to be here today. Thank you so much.
Thank you, Steve. This has been great. I really appreciate it.